A little bit over a year ago, Mitch started having some problems with a little bit of tingling in his arm and his fingers. So we went to the doctor and she took a look at him and said, I think I'll get an x-ray. A couple days later, she called us back into her office and said, you have a disc that has become herniated and it's going to require immediate surgery.
When I woke up from surgery, I felt like I had an elephant sitting on my right shoulder.
We noticed that he couldn't move his arm.
I was having severe pain in my shoulder, and we knew something was terribly wrong because I was getting worse rather than better.
We went in for an additional x-ray, and it showed there was a screw coming out of the plate that the doctor had placed.
We decided to go back in and remove the plate, put another plate in. When I awoke from that surgery, I didn't have a voice. So we later found out that my vocal cord got paralyzed.
I just want our life back. We've gone through a lot. To be perfectly fine one day and almost shattered the next it's been too traumatic.
And before we meet Mitch, I'd like to welcome neurosurgeon Dr. Justin Brown to explain, of course, what causes this type of paralysis. Thank you so much for joining us.
Sure.
Obviously a devastating thing to lose your voice, to lose the use of your arm, but what was going on here with Mitch?
When a nerve goes out, we generally think of trauma. You've stretched it, you've crushed it, you've injured it. But every once in a while, we get a rare condition where you get inflammation in the nerve itself. It can be brought on by a flu or a stressor like surgery. And in Mitch's case, I believe that's what it was because it's actually at a different level than where he was being operated on.
What was Mitch's prognosis if nothing was done here?
Unfortunately, his was poor. Most of these, he's a rare case again, most of these get better, you give him 3 to 6 months. Mitch, unfortunately, we saw him at 6 months, he had nothing. We gave him another 2 months, did another check on the nerves and still had nothing. So there's a time limit on getting these things fixed. We decided it was time to go and it doesn't look like he would have gotten any better if we didn't.
And coming up, we're going to see what Dr. Brown and his team were able to do for Mitch. Stick with us.